Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about how to reduce gut inflammation. So what is gut inflammation? Gut inflammation is when the lining of your digestive tract becomes irritated, swollen, or damaged. Next, how does gut inflammation impact digestion, nutrient absorption, and overall health? When the gut is inflamed, digestion doesn't work well overall. Stomach acid, digestive enzyme production, and bile flow are all likely reduced, which can negatively impact the digestion of our food. If the small intestine is inflamed, then we won't be able to absorb the nutrients from our food or our supplements as well either. Also, with poor digestion, we won't have as much access to the nutrients from our food. If gut inflammation persists, then we likely have some systemic inflammation along with poor digestion and nutrient absorption, which can impact any part of our body. This can lead to digestive symptoms, autoimmunity, chronic fatigue, brain fog, anxiety, depression, eczema, psoriasis, joint pain, headaches, hormonal imbalances, and so on. So what causes inflammation of the gut? Some of the most common culprits include poor diet, food sensitivities, food allergies, impaired digestion, dysbiosis or imbalance of the microbiome or infections, stress, toxicity, nutritional deficiencies, certain medications, and more. Next, how do you know if your gut is inflamed? The most common symptoms associated with gut inflammation include bloating or gas, constipation, diarrhea, acid reflux or GERD, heartburn, indigestion, nausea, and more. These are symptoms that obviously come from direct impact on the gut. Are there any symptoms caused by gut inflammation that can manifest outside of the gut? Some of the less obvious symptoms that can come from gut inflammation include brain fog or poor memory, fatigue, skin issues like eczema, psoriasis, etc., joint pain, muscle aches, headaches or migraines, poor sleep, anxiety, depression, frequently getting sick, respiratory symptoms, and more. A lot of people have gut inflammation but don't have any of these symptoms. So how do you know if you have gut inflammation if you don't have any symptoms? Test, don't guess. Doing a high-quality stool test is the best and most direct way to look at gut inflammation, along with ruling out any dysbiosis or imbalance in the microbiome that can also contribute to gut inflammation. Other testing to consider, in addition to a stool test, that can impact gut inflammation include the following. Food testing, like genetic testing for gluten sensitivity predisposition, food allergy testing, food sensitivity panels, organic acid testing, toxicity testing, looking at organophosphates, glyphosate, insecticides, pesticides, herbicides, phthalates, BPA from plastic products, mycotoxins from mold, heavy metals, and more. Nutritional deficiencies testing, hormone testing, and more. Outside of doing the testing, what is the fastest way to reduce gut inflammation? Here are some simple, immediate steps to consider. Remove ultra-processed foods, added sugars, GMO foods, seed oils, etc. Avoid eating late at night. Doing an elimination diet. And consider intermittent fasting. When you're considering fasting, always consult with your healthcare practitioner to find out if it's a good option for you. Some people just don't function well when they fast, so always consult first. Next, how do we reduce gut inflammation long-term? Here are some of the steps that we use at Restorative Health Solutions to reduce gut inflammation long-term. 1. Remove inflammatory foods and focus on eating clean whole foods and foods that are nutrient dense. Number 2. Support digestion, stomach acid support, digestive enzyme support, gallbladder or bile support if needed. 3. Support the gut lining or gut barrier if needed. 4. Address any overgrowth of bacteria, yeast, fungi, candida, and/or parasites. And number 5, repopulate the gut and build up the beneficial bacteria. To determine what steps you need and how to best address each step, this is where good thorough testing comes in. So what are some other good ways to reduce gut inflammation long-term? Make sure to stay hydrated. Get out in the sun. Get good restful sleep. Practice good stress management strategies. Move your body often and in a way that your body tolerates well. And breathe clean air. Another question I commonly get is, what's the most inflammatory food? This is a really tough question, but I would separate it into 1A, 1B, and 1C. 1A, processed or refined sugars. 1B, seed oils. And 1C, GMO foods or anything that's ultra-processed. And lastly, if you're struggling with chronic gut health issues, have tried a lot of different diets, a lot of different supplements, have seen several different practitioners, have had a lot of testing done, but you still don't have answers, this is where working with a functional medicine practitioner can become very valuable for a lot of people. Working with a functional medicine practitioner, getting really thorough testing done, and putting together that plan for you as an individual can be a big difference maker. Well, I hope you learned a lot today about how to reduce gut inflammation. Until next time, I'm Dr. Paul.